Welcome to the Global Pulse, a short video series where our experts break down a trending topic in international business and why it matters to you.
Key actors along the coronavirus vaccine supply chain are pivoting on a worldwide basis to a whole new set of challenges. From stimulating vaccine development, acting as venture capitalists, governments are moving to become supply chain coordination experts. And at the federal level here in the US, we see Operation Warp Speed, which is directed by both CDC and the Department of Defense, pivot from sponsoring and hosting 7 vaccine development activities, including those from Pfizer, Moderna, Johnson & Johnson, et cetera, to much more of a coordination role. In this role, Operation Warp Speed has contracted with McKesson, which is the largest medical supplier in the United States, to centralize vaccine supply and to help distribute that supply to the states. For their part, the states have been required by CDC to produce and submit, in fact, last Friday, distribution plans. Virginia was the first state in the United States to submit that plan with a $76 million request for cold chain support. And both the federal and the state plans are enlisting pharmacy and grocery chains to become major distribution channels, with a federal contract recently announced to CVS and Walgreens to launch mobile vaccination fleets that can particularly serve nursing home populations that are so vulnerable. And as we go forward, the private logistics service industry is also mobilizing in support of vaccine development. And we have heard the freezer farms that are being developed by UPS in Kentucky. We've heard about FedEx's work in trying to create a cold chain facilities that are unbroken. And so a massive pivot is underway right now. And yet there is a need for better coordination and much more funding across the coronavirus supply chain. And this is a message that has been coming from our most influential and prestigious scientific bodies. The National Academy of Science recently estimated that only 10 to 15 million doses covering 3 to 5% of the US population will be available in the first wave of distribution. And it will take at least 2 years to reach less vulnerable populations in the US, such as teenagers. If we look globally, we see very similar kinds of pivots going on. And one of the most prominent is that of the multilateral effort known as Gavi to assure that vaccine distribution is being made available across the developing world. And so there's been a real effort to try to now move very quickly from the venture capitalist stage to the supply chain coordination and distribution stage. This is an international effort, and it's probably the most complex distribution public-private partnership in the history of supply chains. And we're all holding on with bated breath, hoping that it'll be a great success and we can have a return to normal.